telemedicine for the fulfillment of beneficial and modern health service. Okay, talking about modern health service, it reminds me of the third point of Sustainable Development Goals or SDGs, that is to pursue good health and well-being, right? Okay, to pursue good health and well-being as said in SDGs, we have to make improvement, particularly in decreasing morbidity and mortality rate. But nowadays, the mortality scheme indicates that Indonesia experiences double burden of disease. The situation in which the communicable disease is still a challenge, but the non-communicable disease obviously increased too. So, this is why the non-communicable disease can't be neglected. And SDGs already made a new concern for this case. Ladies and gentlemen, we have to face this circumstance through technology and science. We must admit it. Nowadays, the technology is very important in every sector, right? So, what can we undertake to make a new improvement in the health sector to pursue global goals through technology and science? Okay, there is a collaboration between technology and science named Telemedicine and Search. I have questions for you. Did you know about telemedicine? Telemedicine is an open and constantly evolving science as it incorporates new advancement of technology and responds and adapts to the changing health needs and context of society. In Austria, one of telemedicine service named Hertz Mobility Road helps heart failure patients to get better outcome. As we know, heart failure is the non-communicable disease that needs sustainable medications and treatment. Okay, I have told you about telemedicine, but I think Hertz Mobility Road still sounds strange for you. Okay, let me explain about Hertz Mobility Road. Hertz Mobility Road is a multi-dimensional post-discharge disease management program that helps heart failure patients to get better outcome by telemedical monitoring system. Post-discharge disease management program have been established to reduce mortality and healthcare costs. This network includes specialized heart failure nurse, private practice physician, primary and tertiary referral center. Ladies and gentlemen, I have said before that post-discharge disease management program have been established to reduce mortality and healthcare costs. Indeed, this is how telemedicine brings out the benefits. It defines that through telemedicine, we can make the treatment way more effective because the patient doesn't need to go to the hospital. Okay, it sounds so easy, but is it as easy as it heard? Ladies and gentlemen, nowadays the technology is getting more sophisticated, and so is healthcare. Every stakeholder in the health sector is demanded to be fit into nowadays technology. The more sophisticated technology is, the more modern health service we must serve. So this is why the telemedicine is crucial, because telemedicine can provide the modern health service we need today. Okay, let me explain about Hertz Mobility Road again, especially how it works. Hertz Mobility Road help the heart failure patients to get better outcome because they are trained by specialized heart failure nurses in the use of mobile health telemedicine equipment such as blood pressure, heart rate monitor, scale, and near-field communications mobile phone. So, through this mobile phone telemedicine, it can improve the patient's conditions. It can make the treatment way more effective because the patient doesn't need to go to the hospital. The patient's information can be sent only by this mobile phone telemedicine, and then the information will be received by the doctor and then the treatment can be decided. Designed with mobile health monitoring system, it offers new opportunity to improve patient self-management ability because the patients are requested to provide their daily information of blood pressure, weight, heart rate, and drug intake through this mobile phone telemedicine. Patients are followed for 6 months under the supervision of all the stakeholders. So, during this phase, the patients will learn how to adhere to the treatment and improve their self-management ability. Okay, it sounds so attractive if telemedicine can be implemented, especially in Indonesia, right? But despite of all the benefits that I've said before about telemedicine, did you know that telemedicine also has some risks? Indonesia Medical Ethics Journal mentions that patient data security hacking include text data, audio, and video is one of primary risks of telemedicine system. It is important to note, especially if there is a sensitive data that will be very detrimental if published. Data in United States of America mentions that 1,138 cases of data hacking in 2009 until 2017 involved 164 million of patients. In fact, in United States of America, there is an organization named Health Insurance Portability and Accountability Act, or HIPAA, that regulates the patient's data safety. So, these organizations may help for this case. This is why data protection is important for telemedicine implementation. And the second risk of telemedicine is the telemedicine implementations and maintenance in Indonesia still expensive. Things to worry about is the telemedicine can't be implemented sustainably. Moreover, there is no specific regulations that regulate the telemedicine implementations in Indonesia. So, the telemedicine will still in doubt. Whereas, the telemedicine brings out so much benefit that matters than the risk that we can control, right? Ladies and gentlemen, I hope this telemedicine can be implemented in all around the world, especially in Indonesia. Because I have said before that telemedicine brings out so much benefit that matters than the risk that we can control. Moreover, the telemedicine can provide the modern health service we need today to pursue good health and well-being. We really need this modern health service to fight the disease, the chronic disease, especially the non-communicable disease. Ladies and gentlemen, but for these implementations, we need the interprofessional collaborations between all stakeholders to the success implementations. And secondly, the sophisticated technology must be well prepared, because the sophisticated technology will never bring out the benefit if it isn't prepared well. Ladies and gentlemen, that's all about my speech today. I hope you guys got something new from my speech.